In the exploration of the birth of mental health advocacy, we begin by recognizing the early influences and pioneering figures who shaped this crucial movement in the 20th century. Among them, Dorothea Dix stands out for her unwavering commitment to reforming mental health institutions, advocating passionately for humane treatment of individuals with mental illnesses. Her tireless efforts led to the establishment of more compassionate care facilities, highlighting the dire need for reform. Similarly, Clifford Beers, a former patient at an asylum, turned his personal struggles into a platform for advocacy, challenging societal stigma and promoting awareness of mental health issues. Both of these figures exemplified the drive for change and set the tone for the emerging movement that prioritized dignity and humane treatment. The formation of advocacy organizations marked a significant turning point in mental health advocacy, with groups such as the National Mental Health Association, now known as Mental Health America, being established in 1909. These organizations served as essential vehicles for promoting mental health education, enhancing research initiatives, and providing a voice for those affected by mental illness. They played a critical role in advocating for policy changes in healthcare and raising awareness about the importance of mental health services. Their collective efforts offered support and resources to individuals in need while pushing for greater societal acceptance and understanding surrounding mental health issues, creating a foundation for ongoing advocacy. The 20th century was characterized by significant advocacy efforts that pushed for essential legislative changes addressing mental health care and the rights of patients. One landmark event was the passing of the Mental Health Act of 1946 in the United States, aimed at expanding the availability of mental health services and funding vital research. This legislative change was pivotal in advancing the field of mental health care by enabling a more systematic approach, improving treatment options, and reducing the stigma surrounding mental illnesses. Through sustained advocacy, these efforts illuminated the pressing needs of individuals with mental health challenges and underscored the importance of comprehensive care and support. Media played an instrumental role in amplifying the voices of mental health advocates and raising public awareness during the 20th century. As mental health issues gained more recognition, coverage in various formats, from films to journalistic articles, began to reflect societal attitudes towards mental illness, helping to shift public perceptions. The depiction of mental health issues in movies and documentaries highlighted real-life experiences and challenges faced by individuals, contributing to a forthcoming dialogue that diminished long-standing stigma. As media representations evolved, they helped foster understanding and empathy, serving as catalysts for change in how society approached mental health discussions. An essential aspect of mental health advocacy that emerged in the latter half of the 20th century was the development of peer support networks and self-advocacy groups. These networks enriched the mental health advocacy landscape by providing individuals affected by mental illness with the opportunity to connect, share their lived experiences, and support one another. By emphasizing personal narratives and community engagement, these groups empowered individuals to openly discuss their challenges and develop resilience. This shift towards self-advocacy helped normalize conversations about mental health and created safe spaces where individuals felt understood and supported, further promoting mental health awareness. The legacy of early mental health advocacy continues to significantly influence contemporary advocacy movements focused on exacerbating destigmatization and policy reform. Today, many organizations draw inspiration from the groundwork laid by early pioneers while employing modern techniques, such as social media and technology, to broaden their reach. Furthermore, contemporary advocacy emphasizes intersectionality, aiming to address the diverse experiences of individuals affected by mental illness across different backgrounds and communities. By ensuring that all voices are represented, contemporary movements continue working to create a more inclusive, supportive environment in which mental health issues are openly discussed and understood, forging pathways toward lasting systemic change.